longer than I'd care to admit, but let's move on from that. So I'm also head of evaluation here at the Anna Freud Centre and a professor of evidence-based child and adolescent mental health based at UCL. So my kind of overarching research interest is about empowering young people and families to manage mental health and mental health support with a particular focus on social inequalities. So yeah, I was really pleased to be able to work on this project as that kind of nicely fits in with that. But yeah, it's great to be talking with you all today. I'm sure this is an area that we're all really passionate about and we're all learning more about. So it would be great to hear from your experiences today as well. So I'll be talking about preliminary findings on a qualitative study we did where we spoke to young people from Black and minoritised ethnic groups. And our focus is really about how we can make research more inclusive to young people from such groups. I have to say a particular thank you to Rayma Atachi, who really did a brilliant job leading this work. It was part of her undergraduate dissertation. And yeah, she did an absolutely amazing job. I'd also like to thank other colleagues and collaborators you can see at the bottom of the screen who were involved in this research. And as Nick said, these are preliminary findings, so yeah, please don't share them in the public domain just yet. The key messages that I'll be talking through today, first of all, is why it's so important that when we're thinking about inclusivity of research, we really focus on what the research should be doing, not what participants themselves should be doing. One thing that we heard was really important was epistemic trust, so building a authentic and trusting relationship and rapport between researchers and participants, and how this needs to be throughout the research process. And this was really important to create a safe space for people to be able to share their views. And I'll be going on to define what epistemic trust is a bit later on. Another point, which I'm sure won't be a surprise for many of you, while we were focusing on making mental health participation in mental health research more inclusive, unsurprisingly, the urgent need to increase this also for researchers was one thing that we heard quite strongly. So again, it's thinking about research throughout the whole life cycle, both from taking part in research, but also in terms of being the people delivering the research. So taking a step back, why do we need to think about having greater inclusivity? Well, it will not be a surprise to us that people from Black and minoritised ethnic groups are underrepresented in our research evidence. And we know that there is inequity in mental health support for children, young people and adults from Black and minoritised ethnic groups. So a couple of ways in which this kind of manifests in mental health support we have on the slide here. So we can see that when thinking about referrals to child and adolescent mental health services, we know that young people from Black and minoritised ethnic groups are less likely to be referred through pathways that are voluntary. So they're more likely to be referred through pathways that are considered more compulsory, so such as through youth justice and social care systems. Other research also tells us that young people from Black and minoritised ethnic groups have high levels of unmet need and are less likely to receive mental health support. This can create a bit of a vicious cycle when it comes to research, because if we're conducting research in mental health support settings, and we know that individuals from these groups are less likely to be supported and be in these settings, then obviously young people from these groups are less likely to be included in our research studies because they're less likely to be in our sample pool to begin with. In turn, if young people from Black and minoritized ethnic groups are underrepresented in the evidence on which we develop evidence-based treatments, this then means that these treatments are less likely to be inclusive of the needs of young people from these groups because they aren't represented in the evidence underpinning such support. We also know that historic, but also sadly present, discrimination creates understandably distrust for researchers and medical professionals. And this leads us on to thinking why tackling this distrust and building epistemic trust is so crucially important. And we know that epistemic trust is really vital when engaging with other people in our social environment, particularly when there's a power imbalance, which is obviously true in research settings, where there's a power imbalance between researchers and participants. So we can think of epistemic trust as trust in the authenticity and credibility of the person conveying information. So, for example, this will be a researcher conveying information about a research study when recruiting information. And it's really important to have this, this trust to see the person conveying information as authentic and credible, because if we don't have that trust, then we're not going to be receptive to the things they're telling us. So if we don't have trust in a researcher that we're working with, then we're not going to be wanting to take part in their study. Previous studies have looked at why we have this issue of underrepresentation in research, and indeed a range of barriers have been identified through communication difficulties, biases of researchers, stigma, lack of cultural awareness, and difficulties in accessing research, such as through practical things like transportation costs. But what we noticed when looking at previous studies is that the barriers really focused much more on the individual participants. So it focused on barriers from their perspective. And we thought this really didn't make sense because, as I mentioned previously, there's a power imbalance. The researchers have much more power in the relationship than the participants. So to us, it makes much more sense to be thinking about this from the researcher's perspective and how we can be designing our research studies to be inclusive. Other authors have begun to unpick this question. And here we can see findings from a study that was looking at this question of, are young people, or I think this was across ages actually, so are people from Black and minoritized ethnic groups less willing to take part in research studies? Interestingly, they found no significant differences in consent rates. So young people from Black and minoritized and majority ethnic groups were not any different. There weren't any differences in how likely they were to sign up to take part in a study. They weren't less likely to consent. However, there were significant differences in being invited to take part in the study in the first instance. So people from Black and minoritized ethnic groups were less likely to be invited to participate in the first instance. So here we thought this really kind of added to what we were thinking about, that underrepresentation is much more a result of research and recruitment methods rather than participant characteristics or an unwillingness to take part. So in this study, we wanted to speak to young people from Black and minoritized ethnic groups to really work together and think about their experiences of taking part in research, but also crucially, how we can be better at doing this. How can we make our research studies more inclusive? So we conducted a qualitative study, and we recruited, we contacted about 60 young people, 45 of whom provided consent, and then about 36 completed the next stage of the process, which was an anonymous equity, diversity, and inclusivity monitoring form. So here we found that the sample was quite diverse in ethnicity, which is what we were hoping for. So we had young people from Black, African and Caribbean groups, Asian groups, so Bangladeshi, Chinese, Indian and Pakistani. And then we also had the rest of the young people were from mixed race or multiple ethnic groups, or they were from other ethnic groups. And just to note, the reason we've combined the mixed race and other ethnic groups was to suppress small numbers. So we don't like to include numbers where there are one or two participants because that risks self-identification. This then translated into 31 young people taking part in a focus group. So we had 5 focus groups overall, and these lasted about a couple of hours, and we did them on Teams. They were audio recorded and transcribed verbatim, and we had 2 to 3 facilitators in each of the focus groups. We conducted thematic analysis, both identifying common patterns in the data from the data itself, but also based on our expectations from the previous literature. The analysis was conducted by one researcher, but we regularly reviewed the analysis, the coding framework in weekly meetings. And in the focus groups, what did they look like? So we had kind of 3 main stages of our topic guide. We spent some time doing a recap of the study aims, going over consent. As these were focus groups, online focus groups, it was really important to make sure we were not only clear in the sort of practical processes, but we were really setting these out to be safe and inclusive spaces, and that we were highlighting the importance of listening to each other and treating each other with respect. We had an informal icebreaker activity that all of us, the participants and researchers, took part in. And again, this was trying to create a relaxed and comfortable atmosphere with everyone. We went over what we meant by research, drawing on a real example of a research study. And this was just to help kind of orient ourselves and make sure we're starting from the same page. The substantive part of the discussion was drawing on their experiences of being involved in research, or if people hadn't been involved in research, thinking through, what would make them want to be involved in studies, for example. But basically, we try to go through the whole kind of life cycle of a study, right the way from hearing about studies, signing up to studies, taking part, and needs after the study ended. So here we can see an overview of the summary of the 4 key themes that we identified, and I'll be talking through each theme in a bit more detail in the subsequent slides. But I first of all just wanted to give a bit of a flavour of what these different themes were covering. So the first theme about epistemic trust was really around building a connection with the participant and the researcher. And participants really wanted to get to know the researcher and their motivations for doing the study. Helping to build this epistemic trust was around transparency. So having a clear understanding, not just of why the research was being conducted, but how the information was going to be used. We talked about how people are asked about their ethnicity using the common Office for National Statistics, ONS categories that all of us will be familiar with. And here, this related to epistemic trust, because again, we talked about how participants were able or not to convey their authentic or ethnic identity. Meaning, so why the study was important and why their participation would make a difference was crucially important. Trying to make the topic interesting and highlighting how it could be an enjoyable learning opportunity was something that we talked about with participants. Tying into the idea of epistemic trust, creating a safe space so participants were comfortable to share their views, and having an inviting atmosphere were also described as important. But giving participants a sense of ownership and control so that if there were sensitive topics, they really had a choice about whether they answered them and how they answered them. And we'll also be going on to talk about some things we heard about accessibility. So how this translates into hearing about the study, study materials, but also the opportunities to learn more about research careers. So diving into our first theme in a bit more detail, epistemic trust. Please do feel free to read these quotes in the background as I talk through them. But what I found really interesting wasn't just the importance of really having this connection and rapport with the researcher. I mean, I had always thought this was important when you go on to interact with the participants, so in an interview, in a focus group. But what I found really interesting was how participants were saying this was important right from the get-go, right from hearing about initial information about the study. And participants really wanted, to hear a bit about the researcher and why they were motivated, why they were interested in this topic. And this was really important to start to have this authentic relationship. And it made perfect sense when we talked about it, because taking part in a study obviously involves sharing your views, sharing yourself with the researcher. So having this authentic, trusting relationship from the get-go is obviously going to be really important to making someone feel comfortable and able to do so. As we can see in this second quote, this helps to understand the genuine interest and motivations for someone doing a research study. And the young people we spoke to talk about how, often we get into areas of research for personal reasons as well as professional ones. But often that kind of human element doesn't really come across so much in our research materials. We went on to talk about in the next few quotes about how we can be creating this sense of epistemic trust, particularly when exploring topics around equity, diversity and inclusion. So we had interesting conversations where some people were saying it was important that if it was a project about Black and minority ethnic people, that the research team indeed was diverse and there were Black and minority ethnic people in the research team. Other people were less concerned about there being such representation in the research team if the motivations behind the research were clear. But I guess, although there was a slight shift in emphasis there. I think one thing that was definitely consistent across all participants and focus groups was that it was important that there was diversity in different respects in the research team. So if we're asking for diverse views, it's important we're having and showing diverse views in the research team. So bringing that to light and emphasizing that, which, you know, obviously it's great if it's in terms of ethnicity, but participants were saying other identities were also important when thinking about this. A key thing in trust was understanding how data is going to be used, and is what people say going to be kept safe? Is it going to be private? And is it going to not be used against them? And to us, this made us think about what we'd seen in the literature and what we knew from other experiences, that, you know, there's a sad context of discrimination and disadvantage, understandably creating distrust with medical professionals and researchers. So we thought this, you know, it really made sense to us in this context why it would be so particularly important to be clear about this. Nevertheless, having details, just being transparent, was really described as important across the board. And they wanted this information in a way that everyone would be able to understand. So it was important to describe how data would be kept safe, but doing this in a friendly and inclusive manner. Because if we're giving the information in other ways, then actually if people aren't going to be, if it's not going to be accessible to people, we might not as well be giving it to them. We went on to talk about how we often ask people in research, but also across the board more generally, how we ask people about their ethnicity. And we found this really interesting because when we started these conversations, they weren't actually kind of going anywhere. It was really interesting because people were just saying, you know, it's fine. The kind of traditional ethnic categories we ask people about are quite all right. But when we dug a bit deeper, it seemed that there were much more different views about this. And it almost seemed to us like people were just kind of accepting, you know, this is how people ask about ethnicity. There's nothing we can do about it. And participants indeed said these things. So we're just kind of accepting, you know, how it's being asked about. But actually, you know, when we came to talk about it and really think about it, you know, there was a definite feeling that it wasn't authentic. It wasn't capturing who people are. There were a whole host of assumptions that these categories were being made. Ethnicity was being conflated with nationality. So yeah, there was a real recognition that the current approach was limited in all sorts of ways. Yeah, I mean, it's a hard solution to find, and we didn't quite come up with a solution to this. But one thing that people said as a kind of stopgap, as it were, but to just be really clear about why we're asking about ethnicity. Why are we asking to collect this information? How is it relevant to this particular study? And indeed, as we can see in the second quote, you know, people could really, it's really clear how in mental health research, oftentimes ethnicity may be quite relevant because, as the person saying, you know, ethnicity may bring either trauma, privilege, or vulnerability. So yeah, it was interesting that we weren't, participants weren't saying to not collect this, and if the existing approach isn't ideal, that shouldn't stop us using it, but it's just important to be clear about why we're asking these questions. Conveying the meaning of participation was really important. So being really clear about, what we're hoping will come from this research, what impact will it make to people, but also how does this relate to different parts of the community. So if we're particularly trying to speak to one part of the community, how are we being clear about what the impact might be for that community? And this was really important because people wanted to see how their involvement was going to make a difference, but also make a difference to members of their community and people in their lives. And this was really interesting because there was a real drive to take part in research for this kind of altruistic reason, to be benefiting young people in the future. Reflecting the value and the meaning of participation, a financial reimbursement was described as important, and some people equated this with time they're giving up working to take part in a study. So, for example, if they can't work for an hour to take part, they're losing that money. Having a kind of equivalent financial reimbursement would seem as an appropriate and a really like, we're taking it seriously. We're really saying that your participation is important, and we are recognizing that through a financial reimbursement proportionally to that, but also for inclusivity reasons. Is described as important for those people who wouldn't be able to take part without such a financial reimbursement. People derived meaning from taking part by having the opportunity to learn from each other, and particularly when it comes to kind of focus groups. They described it as a really good experience to hear from different people, but also to hear from different views, to bounce ideas off each other, and to kind of build thinking together. So it was quite interesting that people took meaning from taking part in that way. But again, it was really important how the researcher was doing this, how the researcher was setting up to be a safe space so people could do this, but in a way that wasn't going to be adversarial, but also that they were facilitating the conversation in such a way that was following through on that. After having, well, as part of establishing rapport and building epistemic trust, comfort was really important, and it was really important for participants to feel comfortable with the researcher, but also with the questions they're being asked, the way in which they're being asked the questions, the settings, and if it's a focus group, the focus group format. So yeah, this really kind of followed on from us from this idea about conveying motivations from the start, building that rapport, and then kind of seeing this through. So there's a real human connection throughout the project. And I think paying particular attention to this, given the power dynamic we can see for participants and researchers, is obviously really important. And again, people talked about how diverse perspectives is really helpful for this, because it can kind of help to create these kind of diverse and rich conversations, but in a way that's going to be kind of safe, because if you've got different people from different groups, then that is helping us to not have one group more represented than other groups, for example. The last of the key themes was around accessibility and flexibility in research. And again, this was really strong throughout the research life cycle. So in terms of where we're advertising studies, how we're doing this in places that particularly people who might not otherwise hear about research opportunities can see. And participants were particularly talking about individuals not in education, not in university settings. Conveying the material in different formats, in different types of ways. But also giving people different options for taking part. So as much choice as is possible was described as really important, to have that flexibility and therefore be making the research and participation accessible to people who have different needs. So it might be, if you're doing a qualitative study, offering focus groups, interviews online, in person, having written options in the focus group or in the interview for people who might be less comfortable with verbal communication, having the questions conveyed through written as well as verbally. Yeah, and just giving people different ways to have their voice heard. Although we were obviously kind of really focused on research participation, it was important to think about the other side of the fence. And indeed, this is something participants were really keen to speak about. And again, for us, this came up in terms of accessibility, because participants were really talking about there being a kind of barrier in access to resources, even to learn about research and what research careers might look like. So even to have that kind of initial dipping your toe in the water, you know, thinking about, you know, how would I go about a research career? What does it look like? What does it involve? How I can have this information in a way that's going to be not only accessible and inclusive, but also, you know, make me excited about this, and have that information that's in a way that's being engageable. I mean, right from the get-go, this was being described as a barrier to young people. And yeah, this really was a point of some consternation for us, particularly because the majority of participants were in university settings. So you would think they would have most, compared to other young people not in university settings, you'd think they would have more ready access to such resources and materials. But to hear this was about, to hear that this was a barrier here meant must be only magnified elsewhere. Just to touch on some limitations, as I mentioned, we tried to recruit through a range of channels, but we indeed ended up with predominantly higher education or recent graduates. Not all of the sample, but the majority of the sample. We achieved our aim of recruiting a diverse group, which was we were really pleased with, but absolutely we are not saying that this was a homogeneous group. You know, we are not saying that the views we heard will be representative of all young people from any Black and minoritized ethnic group. So yeah, further research might want to unpick if there are differences between different ethnic groups, for example. But yeah, we just wanted to be clear about this point. And yeah, we did have, unsurprisingly, some technological challenges. I think we gave enough flexibility to make this okay, but we just wanted to flag this because I think it could have impacted on some people's ability to have their voice heard. I think we got through it, but I think I just wanted to flag this, as I think this is yeah, really important to bear in mind. So before I hand over to us to have a discussion, yeah, we can see the 4 themes, but I just wanted to kind of share one sort of final point. I guess one thing we've been thinking about is, you know, it could be argued that these are just kind of good research practices. You know, we were wondering as we were hearing these, you know, are these things that are just kind of good research practice? Should we just be doing them even if we weren't worried about inclusivity. But actually, I think they are good research practice, but I think we know we've got a gap in our research practices at the moment. So I think these findings and these recommendations are actually really important. And although they might seem like they're just good research practice in general, I think they are really important when trying to make mental health research more inclusive. And indeed, you know, we have been implementing a number of these in our studies, from conveying motivations, through to being explicit about why we're asking for information, be explicit about why we are wanting to hear from diverse groups. And already, you know, we've got a long way to go. I'm not saying we've cracked this by any means, but already I do think it's making a difference. So yeah. Any questions, comments? Yeah, really welcome to talk them through, but also just really interested to hear your experiences on how these findings fit or don't fit. You know, if you think they're completely different or you've got a completely different experience, really welcome hearing that. But also it'd be interesting to think through, you know, there might be things you've heard today or things from your own experience, from other people's experience. It will just be interesting to think about how we can take this important area forward and how we can be thinking about any implications for work in our own practice and in our own settings. Nick, I might just hand over to you in case there are kind of questions and to help guide us through the discussion part, please.
Thank you very much, Julian, and lots to think about. I think if other people don't have any questions, I've certainly got some. Time, so I'm just going to say thank you so much to Julian for his presentation today, and thanks to all of you for joining. Thanks also to the other people who were involved in Julian's research, and he wouldn't be able to present without them. So thank you to all of those. From our side, thank you for joining. Do sign up for the other 2 seminars if they're things that you're interested in. We've still got space. So do come along. You'll also get a follow-up email that tells you how to access the recording and ask for just a very brief feedback, which we do really appreciate. So thank you very much for your time, and hopefully see you again soon.
Thanks, everyone.